The most important thing for taking care of a patient, I believe, is to educate the patient. Because I really believe the days of paternalistic medicine where you go to the doctor and he tells you what we're going to do are over, or they should be. I think it's important to sit down and communicate to the patient really what they're getting into. What's the risk? What's the benefit? What are the goals of therapy? Why am I doing this? And I tell a lot of my patients the easy part is the treatment end of it, to pick the treatment and to give it to you. The hard part is really to educate the patient on what I expect of them. What do you need to do to get through this? And also to understand, hey, when something happens, this is what I need to do, or this is an expected problem. I can remember a point in my medical school, and even in a residency, where I said, I know I'll never do oncology, it's just too hard. And as you go through and you become more experienced, you get exposed to more fields of medicine, I think I went back to that and I saw it as really a calling, and I also saw it as a challenge. But one thing that really appeals to me the most about oncology is that it's so dynamic. There are new treatment changes, things are changing right before our eyes, and I think that's exciting. And even some things that we couldn't treat when I started treating, now there are 4 or 5 different treatment options. And I really think that's one of the most appealing things to oncology for me. Well, every patient that walks through the door is unique in more ways than one. Obviously the goals are a little bit different even though they remain the same. But I do think it's important to be sensible with each patient. And for some patients, sure, the treatments can be tougher, and I think it is important to make them understand that you're going to go through a tough treatment with the goal, the endpoint being cure. But if the goal is palliation, then you got to have a common sense approach to it and make sure the treatment is not worse than the disease. One passion that I do have is I really feel that quality of life is a big issue with all of our patients. Whether it be a patient that we're looking to cure from their cancer, and that's the reason that we're treating them, or even if it's a patient that we're attempting to palliate. I do feel quality of care is an important part of what we do. And that's probably my biggest passion, my biggest concern when I see patients.